You're listening to Built Together, the podcast all about Blacks united in leading technology, hosted by Audrey Bell-Kearney. These stories of innovation, collaboration, and upward movement will inspire and empower you. So take out a pen and paper and let's get the party started.
Good afternoon, good evening. It's evening time. I'm so behind time. I spent the whole morning on the golf course. It was amazing. Had never done that before, but it's evening time, and I'm so happy to be here with you this evening. Welcome to another edition of Built Together. I'm your host, Audrey Bell-Kearney, and today I am joined by Dr. Erkeda DeRouen. Erkeda DeRouen. Good. I wanted to make sure I got it right. Dr. Erkeda DeRouen. She is a 3-time certified MD. I need to know what that means. I saw that's like 3-time certified. What does that mean? But we'll ask her on the show. She's also an author, speaker, and a podcaster. Y'all know I love myself a podcaster. So thank you so much for joining me this evening.
Well, thank you so much for having me. And it's just awesome that you got my name on the first try. So thank you for that. And thank you for having me.
You're very welcome. I try my best, because I know some people are really funny about their names. I tell this story all the time. There was a woman, her name was Stephanie. And, we're good for shortening people's names. So I said, hey, Steph. We were in the hallway one day. I said, hey, Steph. She's like, that's not my name. Mm-hmm. And I was like, I'm so sorry. So ever since that day, I've made it my mission to try to get people's name right. I have a big event I have to speak at next in December. And they told me it's like 300 people. I was like, you have got to be nuts. I am not going to call out 300 names because I know I'm going to mess up somebody's name. So they was like, pick the ones that you want to call out, and we'll just tell the rest, they're on the list. It was hilarious, but I was like, that's not going to happen. But thank you so much for being here. So you're the first doctor I think I've interviewed that actually have time to podcast. I'm excited about that because I know you guys are so busy. Tell us a little bit about your background.
Sure. So I am a family medicine doctor, and I know you asked the question about the triple board certification, and board certifications are just kind of like your area of specialty where you have to take exams and kind of show that you're an expert in the field. So I'm board certified in family medicine, lifestyle medicine, and diversity medicine. And I guess I always wanted to be a doctor. I love science and I love helping people, and I'm chatty, as you guys will probably see. So I wanted to bring that together. So I ended up going to college at Hampton University in Virginia, and then I went to medical school at Boston University up in Massachusetts and came back. I'm originally from the DC area. I came to Baltimore for University of Maryland for family medicine residency. And I kind of always thought that I would kind of bring that family medicine vibe and see people from the cradle to the grave and all aspects of life in an underserved environment. So I worked at a community health center for a few years after graduation, and I loved it. I just love kind of having homegirl time with my patients. But I was looking for something a little different, and we're in this era where technology is taking over. So I decided to take a leap of faith, and I ended up leaving my position and starting working at a telehealth organization where I was kind of brought into this world of technology that I never knew much about before. Before working at the company that I worked with, I always thought like, okay, they're just computer engineers and that's it. I had no idea about like user X and all of those kinds of things. So it was an eye opener, and I grew in leadership there. And I've always just been into mentoring, whether or not it was through family members or other students and all of those kinds of things. So I decided to expand and work on mentoring and increasing the amount of women and non-binary people in tech. So I am on the board of Girl Develop It, which helps increase that in tech. And I'm also working as a podcaster, trying to help medical students kind of avoid some of the pitfalls that me and some of my colleagues have gotten into. So I have a podcast called The Prospective Doctor. And I am now working as a healthcare consultant, working on kind of figuring out those complex problems.
So now, do you practice medicine full time anymore?
That's an interesting question. Not traditionally in terms of going and seeing patients in a patient room. I did up until about a year ago with COVID. I was still doing some sessions in an urgent care. But
Mhm.
now I'm at the point with technology where I feel like there's always that part of that one-on-one interaction with the patient in which you can kind of get to know them and all of those things over years. But I want to kind of work to influence patient populations over a larger spectrum. And I think with that and kind of coming up with strategies and also kind of working virtually to see patients, it can help affect and change a lot of things in healthcare.
Yeah, I met a gentleman back in, I think it was September. He had a tele mental health
Mhm,
platform that he owned, which I thought was really interesting. And he was saying how the way he had it structured was so interesting because you could bring on um you can actually get 4 sessions for like $120. And I said to him, how is that possible? Because I know therapists charge a lot of money. And he
mhm,
said, because there are grants out there that will make it possible for people who really need to talk to somebody, but who just really don't want to go into an office setting, especially African Americans, because we don't feel like we need to talk to a therapist. And but that's changing. And so he was like, we wanted to make sure that this platform was available to people, and we didn't want the price to be a hindrance. So they got a $2 million grant, which was nice. So they were
mhm.
able to bring on certified therapists to actually perform the service to people online. They didn't have to leave their house. They just did a session right online. Now we're pretty much used to that, but mental health is going in that direction as well, and I think that's really amazing. Also, telehealth. I know with me, I had like a little sniffle about a month ago. Every time you get a sniffle, you're like, oh my God, what, oh my God. And he was like, no, it's just really it was like allergies. And so I was like, I'm not going to the ER. This is not gonna happen. My doctor couldn't see me. I just picked up the phone and called Teledoc, and they called me in a prescription. I was fine. And so I think that's amazing, where we're going with technology, especially when it pertains to health. Now, there are still some challenges when it comes to paying for healthcare. Is there any difference in telehealth and the way you pay for it versus non-telehealth, like traditional healthcare?
You brought up some really great points, especially about mental health services and the expansion of that, because especially when you people are seeing therapists, which I'm an advocate, I think everyone should have a therapist, but there's an access problem. So when you have to get in, you have to drive there, all of those extra costs, and you're kind of taking out the middleman and you're being able to provide these services for people who may not have had the opportunity to get in or get a visit or pay for it. Like you said, the cost was much lower. So, and then you mentioned about telehealth, about them being able to get you in when your doctor wasn't available and you didn't want to go into the emergency room. And that's the point. Like, people with sniffles should not be in the emergency room. Emergencies should be there, like heart attacks and strokes and things. So it definitely is working to kind of fill that gap and kind of bring those services together, and that brings in the payment model. So it's very complicated, and it's not just like apples to apples with in-person care, but it kind of depends on the partnerships. Like you said, people are getting grants to do these kind of types of things and what the benefit is. So there are some healthcare organizations and that have partnerships with insurances that may have a telehealth component that may say, okay, if this person comes to you guys first and you triage it, of course, everything, and I will be completely transparent, everything cannot be handled by a telehealth services. You can't get a
Mhm,
pap smear and stuff like that. But
mhm.
there are a lot of things like your sniffles, your allergies, and things like that that you can take care of online and kind of bring out that middleman. So there's that cost balance share. And there are a lot of partnerships and different models, whether or not it's you paying a fee for a certain number of visits or for a year, or if you partnering with your insurer or your employer and other things like that to kind of bring those costs down and bring that access to everyone.
I think I'm just amazed at all the different ways people are really learning how to expand their platforms. I met a pediatrician, and she doesn't do any in-office visits, none.
Mhm.
She does house calls,
Wow.
and her patients pay a membership fee.
Mm-hmm.
And I said to her, well, how does that work? She said, because I know I can get to know my patients very personally. I will not be overcrowded with just patients because they have insurance. She said she doesn't take insurance. It was crazy. I was like, you don't take insurance? She said, I don't take insurance. I also met a therapist who said the same thing. I don't take insurance because the minute I take insurance as a mental health professional, that goes in somebody's file that they came to see a therapist. And I was like, and she said a lot of people don't want that. So I'm just amazed at how people are finding ways to do things better and more strategically. I think it's just amazing. I would love to see, maybe you can shed, maybe you know something about this. I would love to see, this is National Breast Cancer Awareness Month, October.
Mm-hmm.
I would love to see an at-home scan where people can sit in front of a camera and do a scan, because that's another thing that I feel like a lot of times women can catch breast cancer if they catch it quick, fast enough. My mom had it twice, and the reason she was able to catch it when she did was because we got an annual mammogram. And I know there are still a lot of people who are afraid to go get. I have friends who are afraid to go get mammograms. It's the craziest thing. I have one friend. Her mother died from breast cancer. She's one of my best friends, and she is deathly afraid. She goes, but it takes her forever to go every year to get a mammogram. And you would think that she would be saying, "Well, since my mom passed away, I'm gonna go," and she doesn't. So I'm looking forward to the day when there's a scan. You can sit in front of a camera and it just goes and just do a scan. So I don't know if that's coming out or not. I don't know if the girl developing or they're developing something over here. But I'm just throwing that out there because I think that'll be great.
I think that would be phenomenal. And I think that you bring up some great points in innovation. One, with you talking about what seems like to be the direct primary care model, where they're kind of going back to old school. Like back in the day in the early 1900s, the only doctors were the people who went to your house, and you kind of didn't have the insurance to kind of say, no, they can't get that medicine and these types of things. So there is an actual kind of new group of people like just coming out and creating what they call direct primary care models. And it could be home visits, or they can even buy their own practice and just not take insurance and do it that way. And then with all of the innovation in terms of technology, who knows? I don't think that there is a point right now for home scans for mammograms, because you need to have certain parameters and orders and things like that. But who knows where we'll be in about 15 years, because I know 5 years ago, we didn't think that telehealth would have become this mainstream. So I can only imagine the other things with innovation that can come in the future.
Yeah, I'm looking forward to the day when we can do certain things. That's just one of them. I know that you are on the board of Girl Develop It, and I want to shift over to technology a little bit deeper. There are a lot of women who probably have great ideas. One of the things, the challenges we face, especially African American women, is getting access to funding and getting the support we need to push out technology. When it comes to Girl Develop It, and you've been on the board, what have you seen as far as us pushing out more tech in that space, and how has that process been for a lot of the women who go through Girl Develop It?
So Girl Develop It is more about building skill sets for women to use to get jobs.
Okay.
I haven't personally seen a lot of the outcomes of it just on my side of the board, but we are working to kind of get women ready to create certain things. Like, for instance, there is our first hackathon that's coming up in November. So if people are listening and they want to join that, they can definitely go to girldevelopit.com and sign up for a hackathon where you can come together and think of these ideas, and you'll have these mentors and people that come and kind of encourage and influence you to come up with great ideas and show yourself how to market it and move it forward. And they're being a person who has seen other hackathons is kind of new to me, because it's not what we do in medicine, but being in technology, I've witnessed a few. There are a lot of projects that start in that very early phase that go on and create whole companies. So it's very exciting that people have that support and that mentorship and those understandings and connections to help kind of bring things forward. So I'll be very interested to see what comes of the hackathon next month.
It's so funny you say that, because I am doing so we have the Black Tech Symposium that just took place in Philadelphia. And the first one was in North Dallas, built around Built. So Built is Black United Leading Technology. So they sponsor these symposiums. So Atlanta is the next one. So that's my area. And so one of the things we just talked about last week was having part of our symposium be a hackathon. And we're like, okay, what are we going to have them hack? because we haven't figured that part out yet. We haven't figured out the hackathon part, but we are looking to have the symposium one day and then a 24-hour hackathon. We just haven't figured out what they're going to hack it. So that's exciting too, because I've gone to one. I've literally been through, like, it was like a weekend. It was amazing because you had, it was about 150 people, which I thought was crazy. And we had to go around the room. We had to stick like notes on the wall with ideas. We stuck them on the wall with ideas, and then when you saw one that you want to work on, you put a sticky by that one, or I think it was a thumbtack or something. The ones with the most thumbtack became the projects that they hacked, which is pretty cool. And I remember these guys, they were young too. They came up with a parking system. I'm talking about a full-blown park. It's called Panda Parking. I don't even know where they are now. They could be done sold to somebody. They came up with a parking system. If you live near a stadium, you could put a Panda parking sign in your yard so people can park. So, because I don't know if you've ever gone to a football game or any kind of sporting events, parking is always a problem. So people don't have places to park a lot of times. So they put it so people can park in people's driveways. And I thought that was so they won. They won the money. I think it was $2,500, but it was so cool. So hackathons are a great way to idea share. And we call it idea crowdsourcing or crowd thinking. I think that's great. I heard something recently, this morning, as a matter of fact. I was on my way down South Georgia. There was a company, and I can't remember the name of it. They have crowd healthcare.
And I was That's like, amazing. I want to hear about that, because I was going to mention that last year I was a part of a hackathon that was hacking racism in medicine. And it was super cool. It was sponsored by MIT and Black Tech Matters. And they just had all of these different categories, like how to affect minorities in mental health, and women who, Black women have a higher rate of having mortality in pregnancy, and all of these different things. And it was just so cool to see the ideas that came together over like a weekend. And they did it virtually, which was super cool, because it was about 700 participants, I think. So it was crazy. But like, they had all the virtual rooms and things, and people were coming together. And in the end result, I was one of the judges, and the speakers there were just phenomenal for them to come up within like 48 hours. So it's been really interesting to see these projects grow over time, because I've connected with them on like LinkedIn and stuff.
Oh, that's pretty cool. Like, I didn't know it was virtual, because that's one of our challenges right now. Like, so the event space that we looked at, it is a tech hub here in Gwinnett County. It's a huge tech hub, and it's beautiful. We're like, this would be great. But when they told us the price, we're like, holy crap. But we're probably going to have some sponsors to offset the cost, so that's going to be interesting too. And then I've been trying to kind of toss around just really working with women in tech. So just trying to figure out how to, which way to go. But anyway, I'm so excited to know more about the hackathon that you guys are doing. What are you hacking again?
I honestly am not sure. So we'll find out. I'll be able to get it to you probably. I'll send an email, but it's on girldevelopment.com. I don't know what the topic is, okay. But they're coming up to ideate and things like that next month for Girl Development.
There are ways to get into technology without knowing how to code or program or whatever. What are some of the careers that you've been able to help women with that was in tech, but they didn't necessarily have to be technologists?
There are so many things you can do with your transferable skills. So honestly, if a woman comes in, they can be a researcher for different tech companies. They can work in HR. They can work in medicine like I do. Women have come and they have been able to just figure out how to organize or be a program manager and figure out different things. So there are so many fields in tech that are not filled by women, and we know that women are great and easy and can create everything, and they usually do it a little better than men. I'm not going to stick it to them, but there are so many ways to come and just think outside the box and kind of show what skills you have. And resources like Girl Develop It and other things like Girls Can Code. There's so many different ones out there. I'm not trying to be biased, but there are so many ways that you can come together and think through what your transferable skills are and how to best shine and utilize them to kind of showcase what you can do and just figure out where you want to go. There's tech in pharma, there's tech in every field imaginable. You see parking spaces, like you said.
Mm-hmm.
So just figuring out what your skill set is and then how to craft it to fit that niche.
I know I don't consider myself a techie. Somebody told me I was. I am a little bit of a techie. I guess I am. I don't know how to code, but I can tell you I can find some no code, low code things and put them together and make them work. One of the things I like about the space that we're in, the podcasting space, is that you can take your podcast and leverage Alexa, which we all know is artificial intelligence, to help you syndicate your podcast to people's homes. So I love, like, when I find new hacks like that, I'm happy to like talk about it. Like I spoke last year, I think it was at it was this year at Podfest, I think, one of those Podfest conferences, about how to get your podcast on Alexa. And people were like, oh my God. So I don't consider myself I'm not a coder. I'm definitely not a programmer, but I can find some low cost, no code ways to make some things happen, and it works out perfect. So I think that's important too. So
You're
let's
a strategist. That's the new title. It's all about using your skills and putting it together to verbalize it.
Yeah, and I do that a lot. I help right now. I'm working with a security company. They someone referred them to me from the chamber, and her company is so amazing, and she's a female-owned security company, which is really nice. And she's been in law enforcement for like 26 years. But as I talked to her, the more I talked to her, I was like, I know there's some technology she needs there, right?
Mm-hmm.
So I'm already thinking like, how can we do this? And I'm already thinking about how to make it work for her. And it's so funny because she's like, I'm not tech nothing. I know how to hold a gun and I know how to kick butt, but not tech. So, and that's pretty cool. Let's flip it and talk about podcasting. How long have you been podcasting?
I've been podcasting for a little over a year, and it's been a really interesting experience. And I just, like I mentioned earlier, I'm very chatty. I love talking to people and sharing ideas and things. So it's been a really good experience to share that with an audience. I inherited the podcast from the previous host, who had been hosting about a year as well. And she had a different vibe than I do. And she's awesome. She's great. And they kind of focus more, it's geared towards pre-med and medical students. And they geared a little more towards mastering the admissions process and talking about different career goals and things. And I've kept that flavor as well, but I've kind of tried to add different things of talking about hot topics in medicine, which people need to know about. So, of course, COVID, and then racism in medicine, technology in medicine, and all those things, and kind of having guests who have done things outside of the box in medicine. So recently I had a doctor who was an anesthesiologist, but he actually left medicine to become a venture capitalist.
Wow.
And yeah, so super cool. And another doctor who ended up leaving medicine because she developed MS, and she started two organizations. So one that brings pediatrics to the daycares in person, like goes there and all of the resources that they need. And she also helps Black women physicians in medicine create entrepreneurship goals and strategies. So just different types of things that are outside of the box has been really cool to learn about.
That's so nice. As you were talking, one of my clients is also the district attorney here in Gwinnett County. And so she and I were having a conversation a couple of weeks ago, and she was telling me it's really hard to get law enforcement people to come into law enforcement anymore because they have all these other options. Do you think that's going to happen in the medical field as well? Because you said he was an anesthesiologist, now he's a venture capitalist, and so and then you have the woman who was a doctor, now she has I guess they're nonprofit organizations. So do you think that there will ever be a shortage of medical professionals? Because we're seeing a hard hit. Law enforcement industry has been hard hit here in our county, in our state, and people are just not finding those positions to be honorable anymore because they do have other options, and there's so much stuff that's going on in that space till nobody wants to put their lives in danger anymore. And I kind of feel like that could be the same with healthcare, because I know people who were in healthcare say, I'm not doing this, I'm not going in there, it's COVID in there, people are not listening to what the medical professionals are saying and the CDC are saying. Do you think there will ever be a shortage of medical professionals in this as we are right now?
So there actually is a shortage already of physicians in medicine. That came before COVID because there are a lot of different things. Like there are a lot of there are a lot of medical students. There are more medical students than there are residency positions. And it's up to Congress to move to create openings for them. So there are people who have taken out like $400,000 in loans for medical school, and they cannot get a job because there aren't any openings.
Wow.
So I think that that's crazy, and that's something that we need to work on and change. But besides that, over time, medicine has had a transformation where, as we mentioned earlier, in the 1900s, it was more like direct service to the patient and doctor, and you guys figure it out and do all of those things. And over time, people have had private practices. Then they went away from that. And now a lot of things are hospital owned. And now people are feeling the burden of those things that come along with not having as much autonomy. And they're moving into things like direct primary care, like you mentioned, or going into telehealth or leaving medicine altogether. So I think that there may be a great migration and there's a great resignation that's going on with every field right now during COVID. But I don't think that, I think people are always going to have the desire to help people. I think that with a lot of the transitions that people are going through at this point in time, hopefully the organizations can take a look at themselves and figure out like what can they do to help with employee retention, and figure out different mechanisms in which all parties can be respected and treated well, and kind of move forward. So I think that there are waves in the way that medical care is given and the different platforms that physicians, mid-levels, nurse practitioners, and everyone uses, but it'll all balance out.
Yeah, I hope so, because I mean, right now, as much as I like tech, a lot of people are scared of tech. I was on the golf course this morning, and one of the ladies, she had a phone like in her pocket, and it just started talking. It's like, see, this is why I don't like tech. This is why I don't like tech. I don't like tech for this reason, because it just started talking. Look, say hi. You bum rush in the interview.
Hi, you came to interview too? My name's Erkeda. What's your name?
Erkeda. She said, "What's your name?"
Teddy.
Hi. She's too adorable.
How you get in here? So this is what happens, guys, when you go live. This I know you got a boo boo. That's a doctor. She helped boo boos.
You got a boo boo? You have to do this and kiss it, and it'll feel all better.
Okay.
He said, "Okay, okay." Let Gia finish your interview, okay? Okay, I'll be out shortly. Okay. She just bum rushing, and I told her mom, I was like, I'm doing an interview, and she said, "Okay," and here the baby is.
Life happens. So
it happens. It's so funny. I was interviewing Peter, who is the founder of Built, right? So I was interviewing him, and his mom walked right through the back of it, and she was, because they were having a yard sale. It was so funny. But I said to him, I was like, "Listen, it's okay if your mom walked in, because my mom passed away in January from COVID, and Lord knows I wish she could have just, So I was perfectly okay with that. Like, listen, it's life. We're home, we're doing things, families around. Sometimes we have control, sometimes we don't have control, and that's okay. And I think for a lot, I remember, I don't know if you ever saw that video where the guy, he was doing the, hold on, mommy, let Gia finish, okay? Go tell mommy. I don't know if you saw the cat. The cat was running across he was a news anchor, and the cat ran across or something, and the wife, she was trying to like duck down. It was hilarious. But what can you do? What can you do?
Yeah, it's life happens, and that's one of the things that has been, I think, one of the positive parts of the pandemic is figuring out that integration in life. Like, you're at home, things will happen, keep moving.
Right. And that's what happened. I'm just telling my daughter to come close the door.
Okay.
Do you think you'll ever go back in the office?
That's a great question. I have been thinking about that recently. At this point, no. I am pretty comfortable with what I'm doing now. I like podcasting. I like healthcare media. I'm also still working in telemedicine. I'm working with a great company that's focusing on women's health called Alden. So I think that life comes in waves. So I never want to say no to anything because you should always take a meeting. You should always see what opportunities are out there. And I think especially a lot of physicians were type A, where they always have their life planned out and the little check boxes. Especially myself, when I went through undergrad and med school and all of those kind of things, I went straight through. So it was always like, what's next? Okay, I'm going to do, when I graduated from residency, I thought I would work at the community health center for 20 or 30 years, but here we are. So I think it's always good to kind of maybe come up with an idea of what you want your next year or 2 or 3 to be, but be okay with change. Change happens, life happens. We didn't expect this pandemic and we're moving with these waves. So we'll see what the next waves are for 2022, hopefully better.
Yes.
And we'll see what happens.
Yeah. Do you see yourself launching any kind of tech product?
I personally do not see myself launching a product, but I am a strong advocate for utilizing the transferable skills. So I think that I probably, if it was the right product, could have some input and some say as to what may be a good idea and maybe do some strategizing with that.
All right. Okay. Well, I think your podcast is probably so powerful, especially when I think about the young folks who are trying to like navigate, coming out of school and trying to find a residency and trying to pay for school. And I think that's probably so powerful. How has the reception been for your podcast in this space?
I think the reception has been wonderful. It's quite surprising, the feedback that I've been getting, and I've become a little more active on social media. So getting the private messages and even speaking to some students and residency programs. I've went and spoken to a couple of schools, and it's just been phenomenal to have this outlet and this source that didn't exist when I was at that stage. So I just am a person that believes in giving back and who doesn't want people to kind of fall into the things that were unknown for me as a first generation med student. So I'm going to keep doing it until they say they don't want it anymore. So the numbers are pretty steady and it's been pretty good.
I don't think they're going to say that. This is a great industry and it's growing every day. I've been doing this since 2009.
Wow.
And I have seen it take leaps and bounds over the probably last 5 years. When I started, it was like, okay, we're just going to do this thing. It's fun. And now over the last 5 years, it has just exploded. And they keep saying, you're at the beginning. It's 15 years. We're 15 years in, but they're saying, you're at the beginning. I'm like, great. Mm-hmm. I came back around. So I'm at the perfect place at the perfect time. So are you. So, and I love what you're doing. So I think it's going to continuously to grow. One of the things I could just say is just keep doing what you're doing. Get on other people's podcasts because that's a great way to grow yours because people will go back and listen. And a lot of times when we're trying to build audience, they'll be like, well, I don't know how to get people to listen. Well, you go get on other people's podcasts because the people that are on those podcasts listen to podcasts. Mm-hmm. So that's like one of the number one ways to grow your podcast is to just keep doing the circle. Not only that, you're just providing great information and great insight, especially to young folks going into, to medicine. And we need them. We need them to come and be innovators. We need new technologies for new health. I saw something. It was a Chinese doctor. He did something amazing where he took out a gene that he took a gene out of these twins. I think he cloned the twins or something. Wow. And then he took out the gene that causes cancer. He went to prison though, because they said it was totally illegal. The twins are adorable. It was crazy. Okay. I'm like, it sounds like some sci-fi stuff, but he took the gene out that causes cancer so they don't have it. Mm-hmm. And I think he cloned them. He did something crazy. He went to prison, but I was like, oh my God, just how do you think like that? So we need them to be able to get past the student loan debt so they can come out and be innovators and continuously push the limits of what we can do and how we can heal people, make people better. I know some freaky ones out there, in that space that want to do all kind of things like clone and, gene splice and all kind of stuff, but we need them because if one thing the pandemic has taught us is that things can change very rapidly and it can be very deadly. That's the one thing this pandemic has taught us. And so we cannot not pay attention to like that. And so we have to make sure that our young folks who are interested in helping, continuously come out of school and get the training and the innovation they need to do so. So thank you for being a podcaster and just sharing your wisdom and your direction with them and helping them, navigate that path. I think that's amazing.
Thank you for pioneering the way. I couldn't imagine being a podcaster since 2009. So that's phenomenal.
Yeah, we started 2009. I have about 215 episodes sitting over on Blog Talk Radio, and right now I host 5 podcasts. I do it 4 days a week live. I do a morning show, and then I do this show. I do a Wednesday show and a Sunday politics show called Popcorn and Politics. So I love this space, and it's really growing. So just stick it out, keep doing what you do. And I know that, you'll see, like sometimes you may think to yourself, oh my God, is this really worth it? And my answer to you is yes. So even when you feel like, I want to quit, don't quit. Just keep, because I quit the first time because I didn't see any money. It's like, there's no money in this thing. Had I stuck it out, I would have been like, making $100 million like some of my podcast friends, but it's okay. We're still early to the game. So how can people reach out to you if they want to get in contact with you, if they want to have you as a guest on their show, if they want to be a guest on your show, how can they contact you?
Well, there are several ways. I'll start with my Instagram. So that is Dr. spelled out DOCTOR, the letter D, and then Graham, GRAM, Dr. D Graham. I also am very active on LinkedIn. It's my favorite actual social media. So just my name, Erkeda DeRouen, ERKDA, last name DEROUEN. And I also have a website. So if anyone is interested in any speaking engagements that I do, because I do offer speaking engagements on a variety of topics, including being a woman in medicine, technology, talking about growth and leadership, that is Dr. Dr. Erkeda, ERKEDA.com. So I'll be looking forward to hearing from you guys.
Well, thank you so much, Dr. Rowan. I really appreciate, you taking the time. You could have been anywhere, but you spent some time with us, and I appreciate you for that. And I'm sure we're going to stay in touch because I'm going to follow your podcast. And listen, if anything I can do to help you push it, let me know. I'll be happy to do that. That's what I do. I help with podcasts. And so as you can see, I love it. Like you, I'm chatty. So that's why I have all these podcasts. And someone asked me, I spoke at She Podcast last week. And this lady said, how do you host all of these podcasts? And I said, I have systems in place. So, I didn't just start this. I have systems in place that makes it run smooth. It was so crazy. I've gotten down to such a science till I looked at my calendar today and I was like, wow, there's nothing on my calendar. Like just my shows, like there's nothing on the calendar. Those are systems, guys. Like I can't just do this. They are systems that are in place. And so when you get in this space, when you get in any entrepreneur space, Dr. Rowan can tell you this, you got to have strategies and you got to have systems to make that thing run smoothly. Otherwise you'll pull all your hair out.
Absolutely. It's all about the organization. So I appreciate it. And I look forward to learning from you and seeing the Prospective Doctor podcast grow. We'll see what happens.
Listen, thank you so much again. Please be sure to, if you got a question, just email me or just email Georgette. If you can't get me, you can always get Georgette. And just let them know I got a question for Audrey. Or like you, I love LinkedIn. That's my favorite platform. I'm a Facebook fan, but I'm always on LinkedIn. So that's my favorite platform as well. Thank you again. Have a wonderful evening.
Thank you. You too. Bye, everyone. Right. Thanks for listening.
All right. Bye-bye. All right, guys, listen, that's all I got for you today. But I will be back again next Monday, 6 p.m. with another good guest talking about tech. And so I want you to make sure to tune in 6 p.m. Tune in. And this is streaming live right now, LinkedIn, Facebook, YouTube, and Roku. Yes, we are. We're streaming on all those platforms. And we want to make sure that we provide you with the best guests and the best information that's going to help you move your career, your business, your life forward. That's what this is all about. Built together, built forward. That's what we do. So thank you again for listening. I'll be back again next Monday. 6 o'clock. Until next time, my friends, until next time, make it a great day. Bye, y'all.
You've been listening to Built Together, the podcast all about Blacks united in leading technology, hosted by Audrey Bell Kearney. If you enjoyed this episode, be sure to subscribe to the podcast and share it with your friends. To support the podcast, visit us on the web at www.builttogether.com. That's www.built2gether.com. Follow us on Facebook and IG at Noise Media Network.